Yes. That's a particular. Yes. When I heard you are coming out.
She will take you in and show you what they are.
Yeah. Working with, in fact, less than 30% is actually working, which is why my health is a problem. So,
Do you know people start volunteers?
You said something about one in Abuja.
yes,
How many years
12 years ago,
it's been established?
the same structure is
It's not well.
Honorable sent me there. I took inventory and 12 years ago.
We can ask you a question.
It include this point. Okay, sir. The only person employed here is this woman. The rest are volunteers. And that is the crisis we face as a country. So we have a budget for those of us who are in office to live a better life when the rest of the country is collapsing and dying. We should care for these people. Healthcare is number one thing we should deal with. So that's why we're here. Then we've visited other facilities and everything. You could see the number of women that are here. That's why we're here.
So what kind of intervention would you, as a person and one that is close to the grassroots, to the people, what would you bring to this?
I've asked her, and I'm going to also appeal to the member of House representing this place, whom I know is a very good man, to intervene. And I'm going to ask other people to intervene. But the problem is that how many are you going to intervene? We have over 30,000 primary health care centers scattered all over the country with less than just about a quarter functional. This is one of the functional ones. And you could see the state it is. So imagine what the other 75 is doing. And that is what we need to tackle. We need to put more money. We are budgeting money for luxuries while abandoning this place. For example, the entire primary healthcare budget for the country, capital budget, is about 59 billion. When we are budgeting over 70 billion to just buy cars and build car park for our legislators. So you can imagine that. So that's the crisis we face. And it goes with the same thing that you are seeing even in other medical care centers. Our budget for state National Assembly Clinic is 15 billion naira for capital vote. That is more than the money you budget that was budgeted for capital vote for University of Ibadan Teaching Hospital, University of Benin Teaching Hospital, University of Nigeria Teaching Hospital, University of Maiduguri Teaching Hospital, University of Ilorin Teaching Hospital, ABU Teaching Hospital put together. That is the crisis we face, and we must deal with it. National Hospital is the same thing. It's 2.8 billion, when Asrock Clinic is 21 billion. So these are things we need to bring to the fore to know health is the number one thing you use to measure development. And we are not investing in it. And that's what we need to invest in. That's why we're here.
This one question. In the next 5 years, if the nation continues in this, what would be the case of the country, amounting from the community?
You could see it yourself. You could see it yourself. You see the deterioration we face. Because we're not doing the right thing. We're not prioritizing the place that needs to be prioritized. Like I said, this is the week of the sick. So I'm going from one facility to the other. Yesterday I was visiting a nursing school where I did plead with nursing council to allow more nurses to be trained, the ones that will export and the ones that we're going to get here, to be able to imagine one staff attending to, we have over 300 women here, and you have only one staff. The rest are volunteers who are caring and everything. That's why I came to see them and to say thank you to Aisha. Us here, we actually just came to visit you and urge you to continue to have hope. In our country, we have no other country except this one. It is for all of us to sacrifice to be here. That is why I'm here today, and to see things for myself. I don't want to delegate and see other people. That's why I came here with this team, to be able to see things for ourselves and then take it from there. Excuse me. So you see me again, or you see my people. Okay, go on.
problem.
Come here.
You can say it from.
The second issue about the message that my district head said that he told you. This women's is not only this women's. Tungama Daji Primary Health Center has more than.
This is why we're visiting here. Like I said, he's still going to give us a few other things we're going to do to be able to support what is happening here. But when I was coming here, I didn't expect to see this large number. I was expecting to see a very tiny place where I was just see 10 to 20 people. So I wasn't prepared. So I'm not going to go back and look at what I'm going to do to support them. So as a token, what I'm going to do is to give this bank card and start with what I have planned. I plan to originally give them 2 million naira. But you could see that when I came here, we were faced with a crisis. So I'm giving 2 million naira.
Aisha, don't keep interpreting. In case that.
We actually just came to visit you and urge you to continue to have hope. In our country, we have no other country except this one. It is for all of us to sacrifice to be here. That is why I'm here today. And
Our health representative. Thank you. Our health representative. Thank you. 92 villages that are under Primary Health Center. 92 villages. Yes.